This slide summarizes how Professor Xicheng Liao and colleagues from our Psychosomatic division used nationally representative epidemiologic data in Taiwan to understand mental health needs from multiple angles. By integrating the Taiwan Psychiatric Morbidity Survey, community-based studies, longitudinal aging data, and nationwide health insurance databases, we were able to examine suicidality, somatic symptom burden, treatment gaps in depression, and long-term service trends in severe mental illness. Together, these findings show that diverse methodologies do more than describe prevalence, they help identify unmet needs, reveal system bottlenecks, and provide actionable evidence for mental health, service redesign, and scalable innovation in Taiwan. This slide summarizes a series of studies conducted by Professor He-Chang Chen in Ilan, Taiwan. Due to age-related physiological and neurofunctional decline, older adults are more susceptible to sleep disturbances. However, their clinical implications differ from those observed in younger populations. First, the Ilan data sleepiness studies validated that daytime sleepiness in older adults is not a unidimensional construct. Second, phenotypic combinations of sleep-wake symptoms carry greater clinical significance than individual symptoms alone. Third, long, rather than short, sleep duration is associated with higher mortality risk. Among individual normative sleep duration, the predictors of future shortening versus lengthening of sleep differ fundamentally. Community-dwelling long sleepers not only exhibit more frequent subclinical physiological impairments, including sarcopenia, muscle weakness, and impaired cardiac autonomic function, but longitudinal evidence further indicates that long sleep duration leads these subclinical functional declines. Overall, findings from the Ilan studies have important clinical and public health implications. This slide summarizes Dr. Iming Chen's work focuses on improving migrant caregivers' mental health using digital tools. His research shows how high care burden and long working hours affect sleep and emotional well-being among Southeast Asian migrant care workers, and why sleep is a key link to mental health. By combining large-scale surveys with data from phones and wearable devices, he develops practical ways to monitor daily rhythms and identify early risk. His work moves beyond research findings toward culturally adapted digital and behavioral interventions that make mental health support more accessible for migrant care workers. This slide summarizes Professor Wei Lai Huang and colleagues from our Yunlin Psychosomatic Medicine team's work on standardized assessment and treatment. The team has localized and validated several screening tools, including the PHQ-15, the Whiteley Index 7, the Health Anxiety Questionnaire, and the CABA. These instruments help clinicians screen for somatic symptoms and health anxiety more accurately in local practice.
This slide describes the Yunlin team's treatment models. They developed an integrated approach for panic disorder that combines biofeedback with cognitive behavioral therapy, and results have been published from a randomized controlled trial. The team is also developing a standardized treatment model for somatic symptom disorder, aiming to provide evidence-based, clinically practical interventions. Professor Wei Lai Huang from our Yunlin Psychosomatic Medicine team also contributed to a Lancet review article covers persistent physical symptoms and their management. As the article states, persistent physical symptoms is an umbrella term for distressing somatic complaints that last several months or more, regardless of their cause. These symptoms often major functional impairment and arise from multiple biological and psychosocial mechanisms. Basic care should combine appropriate medical assessment with person-centered communication, and where needed, targeted psychological or pharmacological treatment.